Hello, I'd like to introduce you to Mr. Kellum, who is our patient for the day. What we're going to do is a head-to-toe physical, but in the sections, that each component that students will need to achieve skill sets in as you move through the physical. These components will be very thorough. It's not an integrated physical. You'll see that they're in sections. Eyes are by themselves, ENT is by itself, and we show you almost every technique you will ever need, whether the patient is well and healthy or has problems. So guaranteed you're going to see techniques and have to learn techniques that have never been done on you for your physical, or you've never seen anyone do. But maybe once or twice in your career you may need them, maybe 1,000 times in your career you will need the skills. So I've already washed my hands and I've walked in the room, and this is typically how you would introduce yourself as a nurse practitioner student to a client. So hello, Mr. Kellum.
Hello.
My name is Susan Denman. And for today, I'm a registered nurse who's studying to be an adult geriatric nurse practitioner. And I'm also studying to get the new clinical doctorate in nursing.
Mm-hmm.
And we're going to be doing components of your physical. Is it all right if I call you Mr. Kellum?
Yes.
Okay, great. So the first thing I'm going to do with Mr. Kellum is a general inspection, and likely I saw him maneuver himself and to get up and sit on the table. But I'm also just quickly looking, just like you do in your regular nursing care. Does anything stand out? He's obviously sitting very straight and comfortable on the table, no distress. The next component of the physical that we have you do for learning is the skin inspection. And you're going to integrate the skin inspection all through your physical. But let me just show you a little bit about how to start. So you look carefully at the skin. While you're doing the skin, you can check the nails. You can even check for capillary refill, or you can do that as part of your cardiovascular assessment. In your future, you'll fine-tune these physical components as best fits the type of practice that you do. General primary care, older adults, patients with illnesses, patients who are healthy. So it's going to change constantly. But I'm not seeing any obvious derm lesions, and I'll continue to integrate and look as I go through. Turgor, we ask you to understand about how to check for turgor. You were probably taught to do it this way over a bony prominence, but most of us have, Mr. Kellum's quite young, so he has great turgor everywhere. But many of us will have reduced turgor over a bony prominence. So it is more accurate to do it here in the fleshy part of the arm, not over a bony prominence, and he has super turgor there also. So we're going to do a hair and head exam. You won't see this routinely on most physicals. It's going to be if there's an issue with the scalp, or somebody comes in and says, I think I have lice, or there's been an injury, or you're palpating the head because the person has headaches and you're trying to see if there's muscle tenderness. So to show you, this is kind of just a general exam that I'm going to do now. And tell me if any of these areas are tender when I press on them or hurt. And then I'm just going to look through his hair. I'm doing this just to show you how you would look through the hair. And as always, do your exam on both sides of the body. It's faster for you to move yourself and walk around than he's young and healthy. It's easy for him to twist his neck every which way. But standard operating procedure, and you'll have to look at my back, would be for me to quickly walk around so that I can see and inspect a little better. And that's it for the general head and scalp exam.